Hi, and welcome to the ToxFox, a central hub for all things toxicology. My name is Anastasia, and I'm an emergency medicine resident in California. Today we're going to talk about pediatric intoxications and the one pill can kill list. Little kids are notorious for confusing medications for candy. EMS World came up with a really awesome mnemonic to help us remember the one pill can kill rule. It is ABC, get mom. A for antimalarials, B for beta blockers, C calcium channel blockers, G glyburide, E ethylene glycol, T tricyclic antidepressants, M methanol, O opiates, M methyl salicylates. Let's do a deep dive into each of these medications. A is for antimalarials such as hydroxychloroquine. These medications will present with quinidine-like effects in overdose, meaning that they'll cause cardiac toxicity. You'll have arrhythmia as well as negative inotropy. You want to give Valium 2 milligrams per kilogram as well as epinephrine to support that cardiac output. B is for beta blockers. Now we've talked about this medication during prior videos, but essentially you're going to have a hypotensive bradycardic patient. You want to give atropine, glucagon, and high-dose insulin. C is for calcium channel blockers such as amlodipine. Again, you're going to have hypotension, bradycardia, but you're going to have hyperglycemia instead of hypoglycemia like you see in beta blockers. The Poison Control Center refers you to the emergency room if your child has ingested greater than 0.3 milligrams per kilogram or greater than 10 milligrams of amlodipine. G is for glyburide, which is a sulfonylurea used by diabetics. It increases your endogenous insulin release and causes hypoglycemia and seizures. You want to give children D25 as well as octreotide. Octreotide binds to somatostatin 2 receptors and decreases your insulin release. E is for ethylene glycol or antifreeze. Ethylene glycol overdose will present with altered mental status, renal failure, metabolic acidosis, and osmolar gap. Ethylene glycol gets metabolized to oxalic acid, which combines with calcium to form non-soluble crystals. These will get stuck in the kidneys and cause renal failure, but they can also lead to basal ganglia hemorrhages later on. You want to give fameprazole because fameprazole inhibits alcohol dehydrogenase and prevents the formation of toxic metabolites. If you're in a resource-poor setting where you don't have access to fameprazole, you can also just give straight liquor like vodka, because this will also act on the alcohol dehydrogenase enzyme. T is for tricyclic antidepressants. Now these are some dirty drugs. They hit lots of receptors. When they hit muscarinic and histamine receptors, they present with more of an anticholinergic syndrome. Remember, mad as a hatter, dry as a bone, blind as a bat? Yeah, that one. When they hit sodium channels, they cause QRS widening and arrhythmias. And when they hit alpha-1 receptors, they present with hypotension. The treatment here is going to be sodium bicarb, 1 to 2 milliequivalents per kilogram, until the QRS narrows to less than 100 milliseconds. You want to refer patients to the emergency room if they ingest greater than 5 milligrams per kilogram of amitriptyline or greater than 2.5 milligrams per kilogram of nortriptyline. M is for methanol, which is found in window washer solution. Methanol metabolizes to formaldehyde and formic acid and causes snowstorm blurry vision and ultimately blindness, renal failure, metabolic acidosis, osmolar gap, and altered mental status. You want to give fameprazole, and you really want to loop in your nephrologist because these patients will ultimately need dialysis. O is for opiates. Everyone pretty much knows what that looks like. Myotic pupils, decreased respiratory rate. You want to give Narcan 1 to 2 milligrams, and you even may need to start a drip. M is for methyl salicylates. This is found in oil of wintergreen as well as aspirin. In overdose, oil of wintergreen causes increased respiratory rate, and this will present as a respiratory alkalosis. Then you will develop a metabolic acidosis because there will be uncoupling of your oxidative phosphorylation in your cells. The treatment here is lots of IV fluids because you want the patient to produce urine, and you also want to compensate for all of the insensible losses that they've had from vomiting and tachypnea. You also want to give sodium bicarb to alkalize the urine, and you want to give it at 1 to 2 milliequivalents per kilogram. Let's go over that mnemonic one more time because it's actually excellent. A is for antimalarials, B beta blockers, C calcium channel blockers, G glyburide, E. ethylene glycol, T. tricyclic antidepressants, M. methanol, O. opiates, M. methyl salicylates. ABC get mom. Thanks for watching the ToxFox, and see you next time.